we can go ahead.
All right. Hi, Dr. Ibrahim. It's nice to meet you.
Jacqueline, nice to meet you too. And I hope you're ready for the diagnosis.
Yes, thank you.
You look
All
ready.
right. So, hello, my name is Jacqueline, and I am here to diagnose you today. What is your name?
So yanda na muka bayani akwai ɗalibai ne za su yi jarrabawa. So yanzu suna kan wannan wanda za ta yi tambayoyi sunanta Jacqueline. Wanda tana so ta dan maka tambayoyi akan rashin lafiyan ranka. Okay, a ba komai kawai ka yi a Hausa. All right, and he says it's fine. You can go ahead, Jacqueline.
All right, so would you mind if I ask you a few questions today?
Okay, he says it's fine.
All right, awesome. So I just wanted to ask if the patient is the kid or the adult.
Patient is the kid.
Patient is the kid? All right, so
yes.
Okay, awesome. So could is the adult his dad possibly?
Yeah, he's his father.
Okay, awesome. So could you please tell me a little bit about your son? How old is he? Is he living with anyone possibly? And of course, does he go to school or anything like that?
Tana so kaɗan yi bayani ne akan shi ɗanka. Yana zuwa makaranta ne ko Islamiyya ko wani function haka kuma yana tare da ku ne ko kuma yana tare da wasu 'yan uwanka ne. Okay. 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 Yanzu yana zuwa Islamiyya ne ko wani makaranta? Shekaransa nawa? Shekaransa 3.5. Okay. So the patient is a 3.5-year-old boy, and practically hasn't studied school, both Western and Islamic education. So he basically stays with his parents at home.
All right, awesome. So why'd you come here today? Is there something that is bothering you?
Me yasa kawo shi asibitin? Okay, zazzabi da me kuma yake damunsa? Okay, yana amai ko gudawa? Gudawa fa? Okay, kwana nawa amma yana zazzabin nan? Okay, all right. So he's been having fever, abdominal pain, and vomiting for 5 days.
Okay, I'm really sorry to hear that. I'll try my best today to make you feel a little bit better. So about the fever that you've mentioned, has the fever been constant or does it break sometimes? Is the fever possibly continuous or even increasing in intensity?
Yanayin zazzabin da ke damunsa yakan zo ya tafi ne? Amma wannan nufi na a cikin kwana 5 ɗin nan kamar zazzabi ɗin ya zo in aka ɗan ba da magani ya ɗan lafa ya sake dawowa. Okay, so he describes the fever as on and off.
Okay, on and off. Awesome. All right. Could I please take his temperature, if that's possible, Dr. Ibrahim?
Yeah, so when he came, his temperature was 37.9 degrees Celsius.
Okay, all right. And when you have the fever, do you ever feel a headache?
Yeah, amma a lokacin da yake zazzabin yakan ya nuna alaman kamar yana jin ciwon kai.
abin da yake nuna da kamar zai ga ya juye da yake da alamun kamar ko ciki yake nunawa.
Okay. Tip.
Kuma amma za ga yana
Okay. He doesn't say it, but he does demonstrate as if he's got some headache.
Mm-hmm. Yeah, that's totally understandable. It's really hard to tell, especially for a kid. All right. So does he sometimes since you've mentioned that he has been vomiting, does he have trouble eating recently? And is there a loss of appetite for him?
Okay, wannan tun da ya fara rashin lafiyan kamar yaya za ka faɗi yanayin cin abincinsa? Yana ci sosai ko baya ci sosai?
gaskiya ina fara da rashin lafiya sai ma ko ya fara cin abinci
Okay.
sai dai abubuwa
Okay.
ruwan masan tuta shi.
Okay. So he's been having loss of appetite.
Okay, that's very good to hear. All right. So does he have diarrhea at all? Stomach pain or even constipation?
He describes it as not having diarrhea or constipation,
Okay.
but demonstrates abdominal pain.
All right. So, all right, I just wanted to ask a little bit about your respiratory system. Do you ever have coughs or runny nose possibly?
A yanayin da ya fara rashin lafiya yakan nuna kamar yana tari haka ko alamun mura. Okay. Dafa. Okay, all right. So he's not been having any respiratory tract symptoms.
Okay, awesome. I also just wanted to look at his hands. If you could possibly compare your hands, Dr. Ibrahim, with the patient's.
Absolutely, Jacqueline.
Okay.
Just a second.
Thank you.
Bari an ga hannunsa ko? All right. So, an haskaka hannunsa. Dan juya hannun ko? So this is his palm, and it's my.
Very pretty
Can you
hands.
see?
Yes. Thank you. I can see.
Okay.
Okay.
All right.
Thank you.
Welcome.
All right, a follow-up question. Does he ever look tired at all when he's around the house? Like, is he weak? Does he have like body weakness sometimes?
Da ya fara rashin lafiya kan nuna kamar ba ƙarfi a jikinsa haka, ba irin walwala yanda ya saba. Okay, so he has some tiredness and body weakness.
Okay, awesome. All right, so I do suspect that you have typhoid fever, but I'm also considering malaria and anemia as my two options, two other possible diseases. So I wanted to take tests just to test for all three of these diseases. So first, could I please get a blood culture for typhoid fever? Dr. Ibrahim?
Yeah, a blood culture came out positive for Salmonella typhi.
Awesome. Okay. And additionally, could I get a rapid diagnostic test for malaria?
Yeah, the rapid diagnostic test also came out positive for malaria.
Awesome. Could I possibly also get a blood smear for the boy? For malaria?
Yeah, the blood smear showed 1+ for malaria.
Okay. And as for anemia, could I get a blood count for hemoglobin levels?
Hemoglobin level was 10 grams per deciliter. 10 grams per deciliter.
Okay. Awesome. All right. So it does look like that the boy does have malaria, typhoid fever, and yeah, so could you please relate my diagnosis to the patient's father?
Okay. Baba Musin, wannan rashin lafiyan da aka yi gwaji an duba kuma an ga alamun ciwon zazzabin cizon sauro shine ke damunsa kuma ya haɗu da ciwon typhoid. So dama yakan zo da irin zazzabi, ciwon ciki, amai, wasu ma da gudawa da sauransu. So kuma shine a cikin magungunan da za a bashi da aka bashi ya fara dan samun sauƙi. Okay. All right, Jacqueline.
All right. Additionally, I also wanted to confirm, you mentioned that he has 10 grams per deciliter for hemoglobin levels?
Yes.
Okay, so after a few reference, I do believe that he does also have a little bit of mild anemia. Since he is very young, hemoglobin levels can be a little bit high to an extent, but also it does indicate some mild anemia. So could you please relate that information to him as well?
Okay. An yi gwajin jini banda gwajin da ya nuna akwai malaria da typhoid, gwajin jinin ma ya nuna jini ya ɗan yi ƙasa amma kaɗan ba sosai ba. So dama irin wannan rashin lafiya kan ɗan sa hakan amma kuma ba sosai ba ne, ɗan kaɗan ne, so ba wai abin damuwa ba ne. All right, okay.
All right, awesome. So I just wanted to explain a little bit about what each disease is, just to inform them of how it's transmitted and the disease itself. So for typhoid fever, it's caused by an infection through a bacteria. And as for malaria, it's caused by a parasite that's transmitted through the bites of female mosquitoes. And since the blood smear showed that you have 1+, it indicates that it is an uncomplicated case of malaria, which is not as bad as complicated cases might be. And as for anemia, anemia mainly results from an inadequate intake of materials that is very essential for the production of hemoglobin levels, hemoglobin as well as red blood cells. So could you relate those information to him?
Okay, all right, Jacqueline. Baba Musin, so bayanin shi ne yadda aka yi shi ciwon zazzabin cizon sauro dama daga cizon sauro ne. Sai kuma shi ciwon typhoid din daga dai abin da mutum ya sa a baki, daga yanayin abincin da zai ci, ruwan da zai sha da sauransu. So shi kuma na haka ce jinin mutum ya yi ƙasa yana da alaƙa da shi wannan cututtukan da kuma rashin cin abubuwan da za su ƙara wa mutum jini. So yana da kyau mutum ya ringa shi kiyaye wannan abubuwan, shi ne zai kare shi daga kamuwa da ciwon nan gaba. An fahimta? Okay. All right, Jacqueline. The information has been passed.
All right, awesome. All right, so I also wanted to ask a follow-up question about medication since I'm moving on to treatments. So has he taken any medications prior to coming to the hospital today?
kafin ka zo asibitin ya sha magunguna a gida ne? Okay. Okay, so he took some medications before coming to the hospital,
Okay.
but he can't remember the names of the medications.
Okay, that's not a problem. It's fine. All right, so moving on to the treatments. So for typhoid fever, I would like to prescribe some antibiotics for him. Ciprotab, amoxicillin are both very great options. And as for malaria, since it is an uncomplicated case, ACT, also known as artemisinin-based combination therapy, is a very great treatment option for malaria. And as for anemia, he does have some mild anemia, so I wanted to prescribe some oral iron supplements. This could raise the hemoglobin levels and possibly reduce some of the body weakness and make him feel better overall. So could you relate those information to him as well? And then I'll talk about some treatments for his symptoms.
Yanda aka yi magana ɗazu, shi akwai maganin da ake bayarwa, ana shi maganin malaria din, ana kiran shi artemisinin-based combination therapy, ACT kenan. Yawa sai ana bayarwa, sai kuma shi na typhoid din akwai antibiotics wanda ake bayarwa, akwai su ciprotab, akwai amoxicillin, duk ana bayarwa, sai kuma dan ƙarin jini kuma akwai magungunan shi ma da ake bayarwa, solid oral iron tablets haka. So shi ma in yana sha yana taimakawa sosai. Okay. All right.
All right, awesome. Okay, so at the beginning, you mentioned that he has been experiencing some fever, and fever is very normal for all three of these diseases. So I also wanted to prescribe some antipyretics just to reduce the pain, the fever and some pain around the head. So Tylenol or Advil would be great options. Additionally, abdominal pain was also very prevalent in his symptoms. So NSAIDs would be a great option as well, just to act as a painkiller for any pain around the body. And you also mentioned that he has been experiencing some vomiting. So please stay very adequately hydrated. So have some fluid yourselves, intake some fluids, whether that is water or even orange juice. I would really recommend orange juice. I'm pretty sure that he will enjoy it as well, or even other drinks. So could you let him know?
Ce ba, da yana zazzaɓi, da a ba da shi maganin da zai dan sa zazzaɓin ya lafa, sai ciwon cikin. Akwai su magungunan da ake kira NSAIDs, non-steroidal anti-inflammatory drugs. Ya sa shi ciwon cikin da sauransu shi ma ya lafa. Sai kuma because yana amai, da a so ya ringa shan ruwa sosai, don kar ruwa ya ƙare a jikin shi. Akwai irin juice ɗin irin na lemu haka. Shi ana kiran shi orange juice. So shi ma dai ji daɗin shi sosai, kuma dai ƙara mishi ruwa a jikinsa. Ko? Okay. All right.
All right, thank you. Okay, so now I'm just gonna talk about a little the prevention methods for these diseases. So for typhoid fever, very good hand washing is necessary. So make sure that he is able to wash his hands very frequently and adequately. And additionally, make sure to monitor and control any sources of bacteria carriers, such as the water, because it can be very easily contaminated with bacteria coming from the feces. And improved hygiene and sanitation is also necessary just to reduce the prevalence of bacteria. And yeah, and as for malaria, I wanted to ask if he has any pesticide treated nets at home for malaria.
Ina kwana a cikin gidan sauro ne a gida? A can fa? Okay, okay. Unfortunately, he doesn't sleep on the treated mosquito nets.
Okay, that's no worry. So make sure to use mosquito nets or even mosquito repellents when you sleep, and as when you go outside, make sure to wear some lawn sleeves as you are right now, and so that there is less exposure to the skin. And additionally, I think that since it is rainy season in Bauchi State, Nigeria, try to avoid going to still water. Yeah, and mainly try to
Okay.
stay home.
All right. Sai yanda za ka yi ya kare kanshi daga kamuwa da cutar, yanda na gaya maka ɗazu, ya ringa kwana cikin gidan sauro, sai kuma ya zamanto yana wanke hannun shi sosai. Duk abin da zai ci ya zamanto ya wanke hannu. Yawa, sai kuma ya ringa sa irin riguna da wanduna wanda za su rufe kafan shi gaba ɗaya, hannun shi gaba ɗaya, zai hana sauro cizon sa da sauransu. So gaskiya yana da amfani sosai. Okay. All right, Jacqueline.
All right, awesome. All right, moving on to the last preventive measure for the last disease. So for malaria, try to get adequate nutrition. I know that you have amazing appetite, which is great to hear. And if it's possible, you can eat food that has more iron and vitamin B12 and folic acid. So those food include eggs, bean, liver, tofu. So could you relate that information too?
Kayayyakin da zai iya ci wanda za su iya kara mishi jini, akwai irin su wake, kwai, duk abubuwan nan suna yawa, suna taimakawa, kuma zai kara mishi appetite na cin abinci da sauransu. Okay. All right.
All right, awesome. So that is all I have for you today. I hope you feel better soon, and thank you so much for coming. It was very nice meeting you, and I also wanted to say that I really like his outfit today. It's
Okay. Ta ce ta gode ko Allah saka da alheri, kuma ta riga jamfan shi ta ce ya mata kyau. Okay, he says thank you, Jacqueline, and he appreciates your concerns and your care for his child. So he thanks you and appreciates your efforts. And I also would like to congratulate you for reaching the end of diagnosis. And I must say you did excellent. As in you did so great. I just like the fact that you took the symptoms and organized all the symptoms and went one by one. You did very great, and I'm really confident you'll make it a very good practitioner, a medical practitioner in the future. I'm so impressed, really. I haven't been impressed as I really am right now. So congrats, and I wish you all the best in your future endeavors.
Thank you so much, Dr. Ibrahim.
You're welcome. So do have a nice day.
Okay, awesome. Thank you. It was nice talking to you.